With coronavirus numbers rising across the country, protesters are fighting against the planned closure of a hospital that serves a majority black community in Chicago. Mercy Hospital is scheduled to shut its doors next year, raising concerns that people on the South Side will have even less access to health care in the midst of a pandemic, as data shows that the coronavirus takes a disproportionate toll on people of color. Joining me now is NBC News correspondent Antonia Hilton, live in Chicago, and NBC News correspondent Tremaine Lee, whose new episode of the Into America podcast looks specifically at Mercy Hospital. Great to have both of you with us. Antonia, let me start with you. What does this closure mean for the community surrounding Mercy Hospital?
Hey, Eamon. So people here are panicked and they're angry. And in fact, there was a crowd behind me protesting here earlier today. They're struggling to fathom why city and state leaders would allow Mercy Hospital, a historic hospital that has served the black community on the South Side, to shut down in the middle of this pandemic. And now people are trying to scramble and figure out where they're going to go in the new year. Provident Hospital behind me is actually where many of their patients are considering going, but this hospital also has its own financial woes. They just had to downsize their ER, lay off some of their nurses, and they don't even allow birthing or maternal care here, which is desperately needed in black communities in Chicago. So people are really concerned, and I actually spent the last several days with a patient at Mercy who's trying to figure out what comes next for her. Take a listen to this.
In this community alone, we have, as I say, over 216 seniors. Then we have a lot of people that are in wheelchairs, walking around with canes, and they can't afford to take Ubers.
What message do you think this closure sends to black and brown neighborhoods here in the city?
Well, I don't know what it's telling them, but it's telling me that you might as well just roll over and die. We don't care about your health.
Etta Davis lives basically right across the street from Mercy, and in the community that she lives in, most people are living on limited incomes. Some of her neighbors say that they get in their wheelchairs and they actually roll over to Mercy, and they're not sure that they're going to be able to afford Ubers and cabs to access the other hospitals around town.
All right, Antonia, stay with me for a second. Tremaine, let me ask you specifically about the message that protesters are trying to send, and how does Mercy's closure fit into the big picture, if you will, when it comes to how this pandemic has disproportionately affected black and brown communities?
Eamon, one thing we know to be gospel is that pre-existing conditions make you more likely to get COVID-19 and to die from COVID-19. And in America, being black and poor is a pre-existing condition that makes you so much more susceptible to the pangs of racism and systemic oppression. But folks here are viewing this closure through that lens, that this is part and parcel of school closures, of food deserts, and now possibly a healthcare desert. And I spoke to one doctor earlier who kind of gave us the 30,000 foot holistic view of this issue. His name is Dr. Thomas Britt. Let's take a listen.
There is blame all the way around. The question is, do you acknowledge that you contribute to this, and what can you do to make it better? And then, so if you acknowledge it, and you're a politician, if you acknowledge it, and you're a corporate entity, and you acknowledge that you're the physician who didn't give this black patient cardiac catheterization, if you acknowledge all these things, are you willing to make a change? And the change is not going to come overnight. We didn't get into this mess overnight. We won't get out of it overnight. But we have to start, and we should start tomorrow.
Now, the hospital will say, we're taking care of the most vulnerable, often folks who don't have commercial insurance, and we're just not making enough money to sustain ourselves. But to the community, a community that has been disinvested in for a very long time, in one of America's most segregated communities, where there is a gap and a silo of social justice issues and police issues and healthcare issues, this is part and parcel of the bigger machine that keeps grinding folks up, and they're pushing to save at least the one resource and one institution that has been there for them. Amen.
All right, Tremaine Lee, Antonia Hilton.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.